Okay, hello everyone. So I hope you all are quite awake right now. If not, I've made my slides quite colorful, so hopefully you'll enjoy it. Okay, so I'm quite excited to present on this topic, basically on the lessons from Singapore's National Centre for Infectious Diseases World AIDS Day campaign, or what we call Following Jason's Journey. Okay, so let's start by giving a bit of background. So as you can see from this chart over here, there's a decline in new HIV infections over the past few years in Singapore. And most of the infections that we have are actually acquired through sexual intercourse. In fact, in 2024, we had about 151 new cases of new HIV cases in Singapore, and half of them were about late-stage infections. So in total, there are about 7,000 people who are currently living with HIV in Singapore. Okay, so while there have been significant advances in treatment, many people living with HIV still face a lot of stigma and discrimination, and this often leads to social isolation as well as reduced access to care and negative impact in terms of their mental health. In a society kind of like shaped by cultural taboos and persistent misconceptions about HIV, we recognize that there's a need for innovative approaches, mainly to raise awareness, as well as empower people living with HIV, build community support, and reshape the narrative through creative and relatable education. So that is why we came up with the four-year World AIDS Day campaign. We followed a journey, basically Jason's journey, through diagnosis all the way to when he aged, drawing on real-life experiences for people living with HIV in Singapore. So even though it's a fictional character, the story that Jason tells were actually based on real-life experiences. So to bring each stage of Jason's story to life, we basically collaborated with a local artist to produce the illustrations. So these artworks form the foundation of a narrative-driven and culturally resonant campaign. Each session that we conducted, so we actually did every year, World AIDS Day, we did a 1.5-hour virtual session. And it also included speakers from multidisciplinary teams, so like doctors, nurses, pharmacists, as well as medical social workers. And also, depending on the topic, we did invite other stakeholders as well. The sessions also included interactive poll sessions, so we conducted it on Zoom. We wanted people to feel like they were involved in Jason's care. And we also did a voiceover for Jason, so on top of the visual presentation and also the text that we provided, we had someone voice Jason as well. Before that, I forgot to tell you that to make basically the entire experience feel authentic, we portrayed gradual improvements in his artistic skills as well, basically to show his personal growth and journey. So the entire narration, we made it seem like Jason is the one who drew all the artwork, made it seem like Jason is the one who's narrating the entire story. So as you can see, as the years go by, just ignore 2021, because that artwork we used from a different year. But 2022, 2023, 2024, you can see the artwork actually changes over time. Okay, so there were a total of 4 volumes which made up the campaign. So we had diagnosis and treatment, employment, relationships, and aging. So for the first one, as you can see, it's diagnosis. So this was when Jason was newly diagnosed with HIV. So the story basically began when he was diagnosed, and he was quite anxious and nervous. So he was telling the audience about that. And he had to seek treatment at our center for HIV. And what happened was, after he mentioned about his anxiety, the talk by the doctor began, and then we started educating the public on what our patients usually, or how they feel, and what they can do to manage their HIV better. And then after that, Jason pops out again and says that he's able to manage his HIV after listening to his doctor, but he would like to continue his treatment and basically have a bit more social support. And that's where we had a panel discussions with medical social workers, advanced practice nurses and stuff like that to talk about living well with HIV. For the second campaign, we focused on employment because these are actually real issues faced by people living with HIV. Employment is a big issue. They face a lot of stigma and discrimination when it comes to applying for jobs, and certain jobs they do have to declare their status. So Jason is someone who actually wants to work as a nurse. So he applied for a job in the nursing side, but apparently he was discriminated, and not offered the position as a nurse. So what we did was we basically, again, the doctor popped up at the screen and said that, why it's important to get tested for HIV. They also went through policies of which, what kind of job scopes require HIV testing and declaration as well, and what do not. We also asked someone from the Singapore National Employment Federation to come and give a talk about the policies that are in place in terms of employing people living with HIV. So these are just some of the visual depictions of Jason basically kind of like deciding whether he wanted to work as a nurse, but eventually, yes, he got a job as a nurse and he was quite happy about it. So for the third volume that we had, we focused on relationships because after finding for a job, he was quite young. He apparently wanted to see how he could form meaningful bonds and relationship with the people around him. So we created more characters this time because we felt that just following Jason might be a bit boring for the audience. So we created a few more characters. So as you can see, Ashley, the one who's pregnant, is actually someone he met during his support group session. So Ashley is someone who's HIV positive as well, and her partner is also HIV positive. So this is where we educated basically the community about mother-to-child transmission, how to prevent HIV, transmission, as well as serodiscordant, seroconcomitant relationships. Jason as well is with, has a partner, and the partner is HIV negative as well. So this is where we basically taught the audience about these kind of things. Oops. Okay, so the fourth volume focused on aging. So Jason, there was a time skip. So I think he was about 28 years old when he found a partner, and then now he's about 63 years old. So as you can see, the one in green is, Jason when he's 63. And we talked about a few topics here. So Jason was a bit anxious about some of the comorbid conditions that he has been having, and polypharmacy as well. So these are some of the things that were discussed during this session. And of course, the healthcare team as well talked about how Jason could actually tackle these issues. The characters that we created previously, Ashley, she had a son, so he grew up, it became Ashton, yeah. So the son basically is, Jason's godson, and then eventually what we did was we wanted the entire story to feel authentic. We killed off Jason, had a funeral, had the godson basically do the eulogy. So it basically followed Jason from diagnosis all the way when he was 80 plus years old, where he passed away peacefully without much complication. So these are just some of the feedback that we received from the audiences in terms of the campaign. So we were quite impressed that people actually followed the campaign throughout the entire 4 years. And every year they will approach me or email us asking what's next. So the campaign, one of the feedback said that the campaign was very well organized. The illustrated storytelling was very touching, and Volume 4 basically wrapped up Jason's story nicely. Someone said that it was a very insightful campaign. It was very easy for laymen like them to understand the lived experiences of people living HIV. Another person said, loved the impactful drawings. It was great to see a multidisciplinary team, basically facilitate these sessions together with Jason. Someone said that the entire story was very touching and they cried, and the campaign was great, and more such campaigns should be adopted with more illustrated storytelling. So I think they felt that it was very engaging. Lastly, someone said they really liked the format of the session, basically walking through Jason's journey and the continuity from the previous years as well. So in total, we reached out to about more than 1,000 participants, through the entire campaign, and it was conducted virtually. And it received an average satisfaction rating of 95%. So every year we maintain that satisfaction rating in terms of our campaign. The interactive storytelling and visual illustration created an immersive experience basically that resonates with the audiences. The sessions incorporated live polls, like I mentioned earlier, that made the audience feel that they were part of the story. And that was quite important because it was very engaging for them. The inclusion of multidisciplinary expert voices also added credibility to the campaign, while the open public format helped to normalize HIV conversations and reduce misinformation. Although the approach proved highly engaging, challenges still remain in engaging all demographics consistently. So the feedback basically suggested that we should tailor the content for both younger and older audiences and an extension of the presentation period as well. They felt that 1.5 hours was a bit too short. Okay, but on top of the campaign that we did, the online campaign, we also thought, I think, basically after the second volume, that there should be a physical campaign that complements the virtual one. So what we did was we conducted the physical event at the hospital, and we focused on a few things that are very important, to the general public who visit the hospital, which is HIV transmission prevention and understanding what U equals to U is about. And these sessions were actually conducted through fun games and activities. And mainly the people who frequent our hospitals are elderly patients because we are close, or basically one hospital together with a geriatric hospital called Tan Tock Seng Hospital. So, we reached out to more than 1,000 people in the physical campaign as well. The public had a chance to also take photos with Jason, which they kind of like. We created a life-size cutout, which you'll see later on in the images, and it was quite popular. These are just some of the photos that I'd like to show you. Yeah, so if you could see in the bottom part, that's a live cutout of Jason, and this is just a physical event. These are basically some screenshots that we took of the virtual event. As you can see, Jason is narrating his story and some of the artworks that he did as well. So in conclusion, following Jason's journey basically highlights the power of storytelling. And we found that storytelling, especially when paired with illustration, can be very powerful and basically very powerful tool in public health education, professional training, and community outreach. So moving forward, we believe that illustrated storytelling basically holds great potential to deepen audience engagement, improve knowledge retention, and make complex public health messages more accessible, especially across diverse communities. And with that, I've come to the end of my presentation, but I would like to thank the following people who made the entire campaign possible, and most importantly, Andre for bringing the entire campaign to life with his illustration. So thank you so much.